We have a heart in both hospitals.
Yes.
And the beating heart of the staff.
Yes.
They're the ones that make the difference. And when I look back at some of the pictures that I have, and it's wonderful to look back and see people's faces, they're not in a mask.
Yeah.
And that makes a big difference. But yeah, I think fundraising was very important.
And I think that's because we're both, all our staff, I would say, are very loyal to the trust they work in and very proud of it. And actually, you know, going outside of their normal working hours to raise money. It's like the hospital shows. It's hard work for both groups, but we do it to bring some humour and fun to what we do, but also to bring the groups together. And we do it in our own time, which I think is absolutely brilliant because of how we feel about the hospital.
I think that's so important, and I think that the patients pick that up, and the relatives. They see that it's one big family and not a production line. And that's the one thing that I think we've always been very keen on at Poole and at Bournemouth, to make it very patient-centred. We are always very patient-centred. I was looking at this picture before we had the multi-storey car park, and I'd completely forgotten how we had to park in the street and hopefully not get a ticket. But it's so interesting to reminisce on these pictures, isn't it?
And actually, we're here at Christchurch today, and I remember when Christchurch was a fully functioning hospital, and we had theatres, stroke ward. We're now in the lovely day hospital, but you know, there's pictures here again I'm going to keep all these. I don't know where they're going to go eventually, of what the hospital used to look like. It's just amazing. But when we were going to close Christchurch, people were feeling that we were taking the heart out of the hospital, but we haven't. We've still got heart here. It's just different. And this is so much better than it used to be. But, of course, we've seen all the changes, and we've also had the VIPs visit us, haven't we?
Yes, we have. Yes, we've got a picture here of Alan Titchmarsh opening the cancer centre. We've had Harry Redknapp open the main entrance, the new main entrance. So we've got quite a lot of celebrities around the Bournemouth and Christchurch area.
Of course, you know, we're Royal Bournemouth. So you might have had Alan Titchmarsh, but we had Princess Anne.
Well, yes, and I mean, the royal matters, doesn't it, really?
Well, it's interesting, though, because if you look at this was Bournemouth General Hospital. It was all about the new hospital, right? And, you know, what we were going to do, and there was a map of the new hospital. But if you see, it's called Bournemouth General Hospital, and we did not become Royal Bournemouth Hospital until Princess Anne visited us.
I think one of the things about Bournemouth and Poole is that we retain our staff.
Yes.
Both of us are an example, over 80 years between us working there. But I was just talking to a consultant the other day, and he said, you showed me how to cannulate in 1990.
Yeah.
And now he's coming up to, he said, oh, I could retire if I wanted, 55. Now, I don't like to discuss age, but like in wine, we mature with age. And I think that that's the nice thing. We see them growing up and we see them coming along and maturing, and we can then discuss on very equal terms with our consultants and our senior nurses about what we really want to achieve. And everybody has that one key thought, how well we can do for our patients. And
we're really lucky where we live, you know, the environment, what's around us, but actually, you know, our careers have both blossomed in RBH and in Poole. We haven't had to move on. We have actually been able to develop, and that's why staff stay for so long.
I think you're absolutely right. We've had a plethora of awards across both trusts. You know, our diabetic team, you know, the Health Service Journal of the Year for yourself. All of these are awards that are in what people would see in a backwater area, but actually they're very forward-thinking. And I think people like you and I, who spend a lot of time in London at conferences, realise just how good we are when we listen to everybody else. And I would say that you've got a better chance to shine in our hospitals because you've got a much broader breadth of services. For over 20, nearly 30 years, we've worked as a team.
Absolutely.
The merger is simply the next stage.
It is.
Which I think is really positive.
I was reading this introduction for our application about building the new hospital. And it says here, Bournemouth General Hospital is more than a magnificent building. It offers some of the finest healthcare facilities in the country and will enable us to set up new standards of excellence and quality. And I think we could replace Bournemouth General Hospital with our new merged organisations are more than just buildings. We are bringing people together, but above all, we remember that this hospital belongs to the people of Bournemouth and Poole and its surroundings. Our aim will be, a right to expect, nothing less than the very best. And I think we've shown that our years of learning, our years of working together, that is what we can do. That aim is still there. We want to provide the best care whether people live in Poole, Bournemouth or Christchurch.
I totally agree.
A shared value. So I think with that, we can go forward. And
absolutely. And I think this is not the end of Poole Hospital and it's not the end of Royal Bournemouth. This is the beginning of a new hospital that will give higher standards of care, build on the wonderful work and staff that we already have, but have a much larger organisation to develop a workforce.
Yeah.